So the women's health section was started about 4 years ago, and it was really led by Rashmi Halkar Singh, as well as Rebecca Wells and Rebecca Birch. And when they started the women's section, they really had two main goals. One of them was to promote women in leadership positions at the American Headache Society. And then the other main goal was to promote research and education regarding women's issues in headache. And so that's been our mission as well going forward, is to really promote the women's issues in headache. And mainly it's in migraine, because migraine is so prevalent, and migraine is so prevalent in women. So most of the research is focused around that, but it's really to promote women's issues as related to headache.
So now that the women's leadership section is kind of separating from the women's health section, we hope that we can focus on three main areas as it pertains to women's health and migraine. So we want to focus on patient advocacy, to specifically try to reach patients through social media and get the evidence-based practices out there so that patients are aware. We want to focus on courses that we can develop for our two meetings with the American Headache Society that occur in the summer and the fall. And we want to try to organize different research projects, specifically focusing around women's health with our members.
So in the past, there have been a lot of great pre-courses that have been put together by our SIG, including issues related to women and the things that are important with women and headache, including oral contraceptives and other comorbidities and other disease states that relate to women who have migraines and headaches. Things like stroke that have been found to be elevated in women who have migraine. So we've put together great pre-courses in the past, and we hope to continue that as well in the future.
So under one umbrella, we hope to develop our patient advocacy program by having Facebook Lives by our members through the American Migraine Foundation, through the Facebook group specifically. We hope that we can make specific clippets that have educational content specifically focusing on women's health and migraine, so that we can reach people with migraine and really distribute evidence-based practices that way.
So I think our section is making an impact because we're trying to reach a very wide audience. One of our goals is to reach headache doctors, but also primary care doctors who take care of headache patients, because we know that a lot of our patients don't ever end up seeing a specialist. So we're trying our best to have a very wide reach with primary doctors, GYNs, other specialists like PAs and NPs that treat headache, but as well as reaching out to patients directly, through some of the Facebook Lives and through our social media campaign. We want to be able to bring awareness, bring education around migraine and around the issues that affect people, and especially women that have migraine.
We would love to see more male members in our group and have a larger reach within the female, male, any gender community within the American Headache Society. Migraine disproportionately affects women 3 times more than men. And so the majority of headache patients that any of us are seeing are women. And so we would love to have everyone come and join our group so that we can get the word out there.